Yes, I do. Hi, John Ashtra, pulmonologist, intensivist at New York Excelsior Group. I have a couple of questions actually. First, I want to comment on Professor Sergi question. What we're seeing as a follow-up after discharge for a patient with COVID. I think one of his question was, how long do you follow up those people from different type of disease like DVT, heart problem? Does those people need to have cardiac testing after discharge? Do we need to keep doing venous Doppler for them? How often do we do it? The follow-up for those patients is a question mark now. We have different protocols over here in the United States. The second question, do you want me to go one by one or?
It'd be great if you can ask one or two at a time, not too many at a time.
So that's the first question, follow up for those patients, from a cardiac point of view, do they need to have a stress test after discharge from the hospital? Do we need to in a Doppler for them? Majority of those people have a very high D-dimer in the hospital, and the autopsy studies did show a lots of microemboli or microthrombosis, which in part could be related for thrombosis in situ more than showering emboli, tending to increase pressure and to weak mismatch. What's your experience on that? And I'm sorry, before we start, majority what we're seeing over here is ground glass opacity on the X-ray more than fibrosis changes for those people. When we see them even in ICU, they still have a very good compliance in comparison to people who have fibrotic changes.
So, Dr. Xu, who should answer this question, you think?
Answer this question. The question is about follow up the thrombosis event. Yeah. In our patient, we find there is a lot of patients have coagulation dysfunctions. Our patient, about 17 to 80 patient, 60% have the coagulation disorders. 17 to 80% patient have D-dimer increased. So so we have the care about the thrombosis events, but unfortunately, we can't have the CTPA or ultrasound available, so we can't confirm how many thrombosis event happens. But we do have read some papers. The study from the Holland ICU hospital. There is 184 patients in the ICU. There's 31% of the patients have the thrombotic event, and 27 was a VTE event. Only 3.7% have the thrombotic event, arterial thrombotic events. So I think this patient, because they have the high risk for VTE factors like the excessive inflammation, hypoxia, immobilization, and the DSE, something like that. So this is what we very care this patient. We cannot do the CTPA ultrasound, but we did VTE prophylaxis for almost every patient if they don't have the they don't have the contradictions. So and I think this patient should be followed up after at least 3 months with the discharge. And for the lung disease, for the interstitial lung disease or lung fibrosis, I think we should follow up longer, 3 months, 6 months, or even 1 year.